Which of the following veins is most commonly used for routine venipuncture? A. Brachial vein. B. Basilic vein. C. Cephalic vein. D. Median cubital vein. Answer: D. The median cubital vein is the preferred site for venipuncture because it is centrally located in the antecubital fossa, well anchored, and has a lower risk of nerve injury compared to the basilic vein. What is the correct order of draw for venipuncture using the evacuated tube system? A. Green, lavender, red, blue. B. Blue, red, green, lavender. C. Red, blue, lavender, green. D. Lavender, green, red, blue. Answer: B. The correct order minimizes cross-contamination of additives. The typical order is blood culture, light blue, citrate, red, no additive, green, heparin, lavender, EDTA, gray, fluoride. Which additive in a blood collection tube prevents clotting by binding calcium? A. Sodium fluoride. B. EDTA. C. Heparin. D. Thrombin. Answer: B. EDTA, ethylene diamine acid, prevents clotting by chelating calcium ions, which are essential for the clotting cascade to function. What complication can arise from using a needle that is too small for blood collection? A. Hemoconcentration. B. Hemolysis. C. Collapsed vein. D. Petechiae. Answer: B. A needle that is too small can increase shear forces, causing red blood cells to rupture, resulting in hemolysis, which can compromise lab results. Which of the following specimens requires strict chain of custody documentation? A. Blood alcohol test. B. Glucose tolerance test. C. Lipid panel. D. Therapeutic drug monitoring. Answer: A. Chain of custody ensures specimen integrity in legal cases, such as blood alcohol content, BAC, testing for DUI, and must document every person who handles the sample. Which vein should be avoided due to proximity to major arteries and nerves? A. Median cubital vein. B. Basilic vein. C. Cephalic vein. D. Dorsal hand vein. Answer: B. The basilic vein is close to the brachial artery and median nerve, increasing the risk of complications like nerve damage or arterial puncture. Which tube should be used for a coagulation study like PT/INR? A. Red top. B. Light blue top. C. Lavender top. D. Green top. Answer: B. Light blue tubes contain sodium citrate, an anticoagulant that preserves clotting factors, making it ideal for coagulation tests like PT and APTT. What is the maximum time allowed between blood collection and separation by centrifugation for serum samples? A. 1 hour. B. 2 hours. C. 4 hours. D. 6 hours. Answer: B. According to CLSI guidelines, serum specimens should be centrifuged within 2 hours of collection to maintain sample integrity and accurate results. Why should the first drop of blood be wiped away during capillary collection? A. It's too diluted. B. It contains interstitial fluid. C. It may contain alcohol. D. All of the above. Answer: D. The first drop of capillary blood can be contaminated by alcohol, tissue fluid, and debris, which may skew test results, so it must be wiped away. What type of isolation requires a phlebotomist to wear an N95 respirator? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions. Answer: C. Airborne precautions are used for diseases like tuberculosis, which can remain suspended in air. An N95 respirator is required to prevent inhalation of pathogens. Which of the following situations is most likely to result in iatrogenic anemia? A. Frequent venipuncture. B. Improper tourniquet use. C. Drawing from a collapsed vein. D. Not mixing the tube properly. Answer A. Iatrogenic anemia is caused by excessive blood loss from repeated venipuncture, especially in infants or critically ill patients with limited blood volume. Which laboratory department processes a CBC test? A. Chemistry. B. Coagulation. C. Hematology. D. Immunology. Answer C. A complete blood count, CBC, is analyzed in the hematology department, which studies blood cells, hemoglobin, and hematocrit levels. How long should pressure be applied after arterial puncture? A. 1 minute. B. 3 to 5 minutes. C. 30 seconds. D. 10 seconds. Answer B. Because arteries have higher pressure, at least 3 to 5 minutes of direct pressure is required to stop bleeding and avoid hematoma formation after arterial puncture. Which specimen is most affected by hemolysis? A. Blood culture. B. Electrolyte panel. C. Coagulation test. D. Glucose test. Answer B. Hemolysis releases intracellular potassium, which falsely elevates potassium levels, thus compromising electrolyte panel results. What is the best action to take when a hematoma forms during blood draw? A. Apply cold compress immediately. B. Continue drawing slowly. C. Stop the draw and apply pressure. D. Elevate the arm and ignore. Answer C. Once a hematoma forms, the draw must be stopped immediately and firm pressure applied to prevent further leakage of blood into tissues. When collecting blood from a patient with IVs in both arms, where should the sample be drawn? A. Above the fore site. B. From the fore line. C. Below the fore site. D. From the hand or foot. Answer C. When both arms have IVs, the preferred draw site is below the fore, or use the hand, to avoid contamination from fore fluids that can alter results. How often should a tourniquet be left in place during venipuncture? A. As long as needed. B. No more than 2 minutes. C. No more than 1 minute. D. Until blood starts flowing. Answer C. Leaving a tourniquet on for more than 1 minute can lead to hemoconcentration, where blood components become falsely elevated due to fluid loss. What is the term for the intentional misuse of lab results for financial gain? A. Battery. B. Fraud. C. Negligence. D. Abuse. Answer B. Fraud involves knowingly misrepresenting facts, such as faking test results or billing for unperformed tests, to gain monetary benefits. Which of the following is considered a nosocomial infection? A. Influenza caught at school. B. Infection from a dirty needle in public. C. Pneumonia contracted in hospital. D. Diarrhea after food poisoning. Answer C. A nosocomial infection is one acquired inside a hospital, often due to invasive procedures or compromised hygiene. Which test requires the patient to fast for at least 8 hours before collection? A. CBC. B. Glucose tolerance test. C. Point/INR. D. ESR. Answer B. The glucose tolerance test, GTT, requires fasting for 8 to 12 hours to establish a baseline and ensure accurate measurement of glucose metabolism. What condition results from drawing blood too quickly or forcefully from a small vein? A. Petechiae. B. Hemoconcentration. C. Hemolysis. D. Hematoma. Answer: C. Drawing blood too quickly or with excessive suction, especially from fragile veins, causes red blood cells to rupture, leading to hemolysis, which can distort test results and may require recollection. A patient begins to have a seizure during venipuncture. What is the phlebotomist's immediate action? A. Hold the patient tightly to prevent injury. B. Remove the needle and call for help. C. Continue drawing until the sample is complete. D. Insert a second needle for additional support. Answer: B. During a seizure, safety is paramount. The needle must be removed immediately, and the phlebotomist should call for medical assistance, ensuring the patient doesn't fall or become injured. Which colored tube is used for lactic acid testing and must be placed on ice? A. Lavender. B. Gray. C. Light blue. D. Green. Answer: B. Lactic acid levels are sensitive to time and temperature. The gray top tube, which contains sodium fluoride, prevents glycolysis, and the sample must be chilled on ice immediately to prevent falsely elevated results. Which of the following is the most appropriate site for capillary puncture in an infant under 6 months? A. Heel. B. Toe. C. Finger. D. Earlobe. Answer: A. In infants younger than 6 months, the lateral or medial plantar surface of the heel is the safest site for capillary collection due to low risk of bone injury and sufficient blood flow. What is the purpose of inversion of tubes after collection? A. Prevent air bubbles. B. Mix additives with blood. C. Cool the sample. D. Activate clotting. Answer: B. Inversion ensures the additive properly mixes with the blood. If not mixed correctly, clotting may occur in anticoagulant tubes, resulting in inaccurate or unusable specimens.